right, did you make it so I can share the screen? Yes, perfect. Can everyone see my screen okay? All right, so I had major depression, and for the diagnosis, it goes off of the DSM-5, and for someone to be diagnosed for major depression, they must have 5 or more symptoms that are present for the same 2 weeks and affect a level of functioning. So these symptoms can include significant weight loss or gain, insomnia or hyperinsomnia, psychomotor agitation, fatigue, feelings of worthlessness, impaired cognitive function, or recurrent thoughts of death or suicide. At least one symptom must be a depressed mood or loss of interest or pleasure. And the diagnosis is characterized by experiencing at least one major depressive episode without the occurrence of a manic episode. So that would be those like feelings of like you're super happy. Diagnosis related precautions. Obviously, someone who's depressed is going to have that increased risk of experiencing pain or illness, decreased physical, social, and role functioning, and they are a risk for suicide and self-harm. There's no known cause for depression, but there are some genetic factors and decreased availability of some neurotransmitters such as norepinephrine and serotonin. Environmental factors include exposure to early life stress or trauma, and psychosocial. So different personality types may have a higher risk, such as OCD, ADHD. And it's also been noted that people who have parents with depression are at a higher risk of also being diagnosed. So it's almost 2 times more common in women than men. And actually 1 in 5 individuals are likely to experience depression during their lifetime. It's greatly underdiagnosed, especially in elderly individuals. A lot of people think it's just teenagers and young adults, but it's actually a really common diagnosis in the elderly. Related disorders, disruptive mood dysregulation, persistent depressive disorder, and premenstrual dysphoric disorder. Risk factors include temperamental, so having a well-established neuroticism, environmental, so adverse childhood experiences and stressful life events. So like kind of those ACEs, if a child is exposed to a lot of stress or a traumatic experience, they're a higher risk for depression. Genetic and physiological. First-degree relatives with major depression disorder have a 2 to 4 times higher risk than the general population. Medical management, SSRIs or SNRIs are commonly used. And if those medications don't work, the individual may be prescribed different types of medication, but these often come with worse side effects. So those are kind of the last resort. Complications and impact on professional performance skills and occupations. So obviously major depression can be very severe and affects a lot of occupations and our performance. The symptoms of major depression interfere with a person's ability to work, sleep, recreate, eat, and learn. The impact on occupational performance can vary greatly depending on the individual's severity of symptoms, responsiveness to their treatments, and co-occurring conditions and other factors. Symptoms of depression often decrease motivation and inhibit one's ability to complete occupations such as self-care, education, work, and social participation. So some evidence-based interventions that I found. The first one is animal-assisted therapy, and that's basically involving animals in the treatment plan. for an individual, for example, with MD or major depression, because many people interacting with animals can provide a positive bond that creates feelings of worthiness and a calm state of mind. This interaction can help reduce symptoms of depression by increasing physical activity, improving mood, reducing boredom, and providing companionship to reduce loneliness. Some evidence I found for animal-assisted therapy include a study by Kukorikos, I'm sure I didn't say that right, found that interactions with animals can cause biochemical changes in the brain. So those neurotransmitters that I talked about previously, the norepinephrine and serotonin, are actually released when people are interacting with animals. And that creates feelings of relaxation, improves mood, and reduces anxiety. A study conducted by Burgett found that animal-assisted therapy with farm animals resulted in a significant decrease in depressive symptoms in psychiatric patients. There's a lot of research out there about using like dogs and cats, but there wasn't a lot for farm animals, which was especially helpful for people who used to work in agriculture or were previously farmers. The theory that I decided worked well with this was the PEO model, because it looks at the relationship between the person, environment, and occupation. The goal of the model being to establish the best possible fit between the person, environment, and occupation. Animal-assisted therapy can improve occupations such as social participation, ADLs, and functional mobility by maximizing the fit between the person and their environment. So the impact on occupational performance, people often experience an increase in self-care and ADLs due to taking on a caregiver role with an animal. Animals also offer an increased opportunity for physical activity and functional mobility. People with mental illness often lack social participation and social skills, and this bond formed with an animal is actually surprisingly similar to a bond formed between people. And through these interactions with the animals, people can gain a knowledge of acceptable and non-acceptable social behaviors. The next one that I found is cognitive restructuring, and it's actually a form of CBT, and it involves changing the way a person thinks to treat depressive symptoms. The goal of it is basically to eliminate negative thoughts and replace them with positive ones. So for evidence, a study by John Coe found that cognitive restructuring is associated with increased cognitive flexibility and a reduced rate of self-reported distress. Another article I found was from Akinsola, and they report that cognitive restructuring reduced depressive symptoms and resulted in improved academic test scores. For theory, I chose the cognitive behavioral theory because it states that a person's thoughts, emotions, behaviors, and senses are all interconnected, meaning that the way a person thinks affects the way that they feel. And cognitive restructuring utilizes this theory by altering the way people think to change the way that they feel, hopefully to minimize symptoms of depression or other mental illnesses. Impact on occupational performance. Obviously, the change of thinking and increased flexibility results in a stronger ability to focus and improve academic test scores. So just increasing one's ability to learn. Reduced feelings of distress can encourage increased rates of social participation. The elimination of negative thoughts can result in an overall positive mindset and motivate creativity and learning. And also positive feelings can create feelings of worthiness, which encourages pride and appearance of self. So this is going to help motivate a person to complete ADLs, such as dressing, and IADLs, such as cleaning their house. So here's my references. Does anyone have any questions, comments?
I thought the part about like the agriculture was really cool because I feel like it's normally just like dogs and cats and whatever, but looking at like livestock, that was really interesting.
Yeah, I also thought that was interesting, which is why I included that in there. because commonly they just use like cats and dogs and horses or birds, just typical pets. But then having people actually go out, and I think the article did talk about having psychiatric patients come to like a farm and work there or do different things that you do around a farm. And there was significant reduction in depressive symptoms.
Yeah, that's really, really cool.
And I think it's also
Yeah.
interesting because how you mentioned how major depressive disorder is in elderly people, and there's a lot of farmers out there who probably like going through different life events such as retiring can be really hard for them, and that's probably a factor into elderly people having depression. And so just having them be able to still have therapy with farm animals if that's what they've been around for so long would help.
Yeah, it is really cool, especially since a lot of the elderly population now were farmers in the past. I think it's a good thing to have out there.
Yeah, for sure. Nice job.
All right, so I will stop sharing.
I can go next. Can you guys hear my computer like screaming? Is it like, no? Okay. Sounds like it's like running a marathon right now. Okay. Can you guys see my screen? Yes. Maybe. Okay. Ah. Can you guys see it? Yes. Okay. Perfect. Okay. So I had borderline personality disorder, BPD. And this one I noticed when Peyton was presenting that it very much aligns with antisocial personality disorder. So there's a lot of similarities between the two. So it is as well a cluster B diagnosis, which makes it dramatic, emotional, and erratic behaviors. Some of like those symptoms that are associated with it, the difficulties with impulse control and the emotional regulation, fears of abandonment, which can in turn lead to inappropriate anger or different outbursts. And then there's also the black and white thinking, which leads to intense emotional reactions and drastic mood swings, which is kind of inside of the emotional regulation part. Some of the risk factors and related disorders include possible psychotic symptoms, especially when they're experiencing acute stress. And then those related disorders are going to be the depressive disorder, bipolar disorder, anxiety disorder, sleep disorder, substance use disorder, and like I've said before, the antisocial personality disorder. The etiology is unknown, but there is evidence of genetic predisposition and early life experiences that can contribute to the onset of BPD. The risk factors of BPD include physical, emotional, and sexual abuse, in addition to the neglect that someone might experience. For medical management, there's a lot of medications, just like there are for a lot of these other disorders, anxiolytics, neuroleptics, mood stabilizers, antidepressants, and then going away from like the medication, like the pill side of things. Individuals can take like anger management classes, experience like the mindfulness, and then use meditation as another form of managing their symptoms. So BPD is more common in women, and Chapman et al. 2022 found that 1.6% of the adult population does have BPD. Out of that population that has been diagnosed with it, 10% of the individuals are found in outpatient psychiatric settings, and 20% are found in inpatient psychiatric settings. Few of the diagnosis related precautions include self-harm or the suicidal attempts, substance abuse, risky sexual liaisons, self-injury, overspending, or binge eating. And those ones in that bullet, they're all examples of what impulse behavior would be with that symptom of impulsivity. Self-inflicted behaviors like cutting, biting, and burning are also related precautions to BPD. Few of the complications in the motor skills, processing skills, and social interaction skills would be the impulsivity having a harmful effect on a client in regard to the biting or cutting. So those self-inflicted behaviors can have an impact on the motor skills of someone with BPD. In regard to processing skills, that impulsivity also can cause an individual to demonstrate an instability use of their selves. And then with social interaction skills, the instability may occur within relationships. Mood swings might occur like anger, fear of abandonment, and that could result in social situation difficulties. Okay, so for the interventions that I found mentalization-based treatment and dialectical behavior theory, which after listening to everyone's today, I think we're kind of familiar, but I'm going to kind of go into how it's specific for BPD. So mentalization-based treatment, or MBTs. So the symptoms that is associated with BPD is difficulties with that emotional regulation and impulsivity. MBT aims to make a person aware of their own as well as others' mental status. Utilizing MBT as a form of treatment for BPD allows individuals to better mentalize and understand their life process. So the evidence that I found for MBT, there was a study by Bateman and Fanangi. They found that by using MBT as an intervention for individuals with BPD, there was a significant decrease in suicide rates. The form of treatment ultimately allows for an individual to optimize their arousal level, and they become more in tune with their own emotions. Carlisle et al. 2020 also found a significant reduction in suicide attempts and self-harm among those individuals with BPD when using an MBT as the intervention. The theory that I thought best fit MBT was the cognitive behavioral theory, or frame of reference. So CBT aims to cover the person's cognitive beliefs during the recovery process of a given diagnosis. CBT also is used to redirect the brain's thinking process as it learns a new way to think. OTs use CBT to help an individual engage in their meaningful occupations. The improved performance skills that MBT can impact can be specifically used to mitigate the symptoms that are associated with BPD, including the self-harm, suicidal attempts, impulsivity, self-inflicted behaviors, and intense emotional reactions. As MBT aims to reduce these symptoms, an individual is able to improve their motor, processing, and social skills by mentalizing and being more in touch with their own and other mental status. So then the second intervention is the dialectical behavior theory, which we did learn about in class. So DBT is the #1 supported treatment for individuals with BPD. DBT looks at the correlation between acceptance and change from the individual's point of view. Utilizing DBT with an individual has helped BPD individuals develop adaptive behaviors from maladaptive behaviors. When I was researching these, it was not hard to find interventions specifically for BPD. There were a lot of articles that were specific to using DBT with BPD. So the evidence, one of the articles I found was May et al. 2016, explained that all 4 components of DBT, which includes skills training group, individual psychotherapy, telephone consultation, and therapist consultation team. DBT in relation to BPD focuses on unstable sense of self, chaotic relationships, impulsivity, and more, which are those common BPD symptoms. Another article by Corner and Linehan, 2000, provided an explanation of how DPD can be used for those that have BPD along with a comorbid disorder. Other disorders that they may be experienced along with BPD include this substance disorder, binge eating, and it can also be used to reduce the hospitalizations as well as that maladaptive behavior. DBT I also found for the theory I thought it best fit with the cognitive behavioral theory. So the same would go for what I put for MBT down for the DBT. So for improved performance skills, DBT can improve social interaction skills by improving mood swings and impulse control issues. Individuals with BPD can utilize DBT to regulate emotions and control different impulsive behaviors. Processing skills can also benefit from DBT as a person's able to better control their impulsivity and how they might cope with unstable situations. So really, in turn, all these different therapies I found focus on the two big symptoms of that impulsivity and like the emotional regulation. There are my references. Does anyone have any questions?
I found it interesting because you had said that ours were super similar, and then in mine it was like more prevalent in males, and in yours it was more prevalent in females. So I don't know. And then when you kind of looked at like some of the symptoms and characteristics of it, it is more like female oriented, like for like societal norm wise. So
Totally.
that's kind of interesting.
Yeah, I feel like for besides of like the gender aspects, like the treatment and like intervention styles of it, it's crazy how like it can be used for two separate things and like two different types of people.
Right. Good job.
Thank you.
All right, can you guys see my screen? Perfect. All right, so I had social anxiety. So social anxiety is just having a hard time in social interactions. So diagnosis would be blushing, sweating, or trembling in social interactions, rapid heart rate, the person feels their mind going blank, or they feel sick to their stomach. They have a stiff body posture or speak with an overly soft voice. They also find it really hard to make eye contact, and this can even be with people that they're super comfortable with, or else it can be strangers. They feel self-conscious that other people are judging them when they are speaking. And typically they try to avoid places that they know others will be. The etiology, overall, it's unknown, but it's likely from a combination of how biological and environmental factors interact. So there's the inherited traits. So just like most other diagnoses that we've talked about today, it's known to run in families. So there's some genetics behind it. Brain structures. So someone could have an overactive amygdala, and this can cause the heightened fear response. And then environment. So it can be a learned behavior if someone's had been in an embarrassing social interaction in the past. Prevalence. So this is one of the most prevalent mental health conditions. And with that being said, more than 80% of the people who have social anxiety don't actually seek treatment. And this is more frequently in females than males, social anxiety is. Some risk factors, there's the family history, negative experiences, the temperament, depending on what temperament you have. If they are in some new social environments or have more work demands drawn onto them. And then another risk factor would be if they have a condition that draws attention to them. Some diagnosis related precautions would be substance abuse disorder, major depressive disorder, and self-harm. Medical management, so it can be a combination of psychotherapy and medications, or it could just be one or the other. So for psychotherapy, CBT is big, and this just teaches various ways of thinking, behaviors, and reacting to different social encounterments. Medications, there are 3 different ones that they can take. Antidepressants would help treat the symptoms. Beta blockers would help control those physical symptoms we talked about. So like the rapid heart rate, the trembles, the stiff body posture. Anti-anxiety medications would help reduce the anxious feelings. So some complications and related to the impact on performance skills. So they could have low self-esteem, trouble being assertive, they could have negative self-talk, and then isolation and difficulty with social relationships. So all of these would play effect on all of the performance skills needed for social interactions, such as initiating and terminating social interactions, producing social interactions, physically supporting social interactions, shaping content of social interactions, maintaining flow of social interactions, and then verbally supporting social interactions. So some evidence-based interventions that I looked at was, the first one would have been cognitive behavior theory. And so CBT is one of the most successfully known treatments for anxiety disorders. And this helps develop skills that people can use to reduce anxiety. And then after the skills are built, CBT will slowly expose the person to the feared situation so they can practice using the new skills they have learned. And so an example of this could be helping them build self-efficacy. A study conducted by Tellman and his colleagues supports the use of CBT among children with social anxiety disorders to help alleviate the symptoms. The theory that I put with this is the social cognitive theory, as it helps highlight the important roles of social, cognitive, and behavior and environmental factors for human learning and behavior change. So it really just ties in how you have the different factors play a role into behavior changes. And CBT helps improve all of the performance skills that we just talked about on the first page, as it can be used to help with the overall social interactions by teaching new skills to help alleviate any symptom the person is having. The second one I looked into is mindfulness-based cognitive theory. And so this is a therapy method that is used to help reduce stress. This therapy method helps people acknowledge, evaluate, and correct their thoughts. And so this will help the people notice their negative thoughts and replace them with more positive thoughts. And replacing the negative thoughts with more positive thoughts helps a person improve their quality of life and helps the stress and anxiety go away, as they just have a better self-image of themselves. The evidence, a study conducted by Ray and his colleagues, supports the use of mindfulness-based cognitive theory to help improve self-esteem and self-concept to reduce social anxiety. The theory that I tied to this one is PEO, just because we can't really change the environment, but we can help the person change aspects about themselves to change their self-thoughts, and overall helping the person with positive self-thoughts will increase their engagement in occupations, especially the social participation. And so the improved performance skills, MBCT can help improve a person's self-esteem and negative self-talk. With an increase in the self-esteem and more positive self-talk, a person will be able to have a better social interaction, as they won't have so many negative thoughts. Increased self-esteem will help the person feel more confident in starting a conversation and even feel comfortable maintaining the eye contact with another person throughout their conversation or interaction. And here are my references. Does anyone have any questions?
I guess I was just going to say that I think it's interesting when you said like 80% of people don't receive treatment for it. And I feel like that's really hard because like there seems to be, you found evidence for a lot of different things, like different cognitive therapies that you can help them. And it's like, how do you get them there, you know?
Yeah, for sure. And it's like a touchy thing. I feel like people don't want that stigma placed on them. And so it's a big reason why someone want to go get treatment.
Yeah, I agree because I think that's like a super common disorder that people sometimes don't like think about unless it's like one like a bipolar, like other things like that. So it's really telling that 80% don't see treatment.
Mm-hmm. For sure. All right.
Okay,
Well,
good job,
nice
everyone.
everyone.
Good job, everybody.
Stop
I have a